And so now we will shift gears and talk about the vaccination program here in Halton. Next slide, please. As of June the 28th, all Halton residents aged 12 and older became eligible to receive second doses at a shortened interval. On June the 30th, Halton residents who received their COVID-19 vaccinations outside of Ontario became able to report their vaccinations to public health. Once a form is submitted, public health will contact the resident to confirm whether the COVID-19 vaccination is valid in Ontario. Once verified, public health will add the individual's record to the provincial COVID-19 immunization database, and residents will be able to retrieve their vaccination receipt from the Ontario online portal. Residents who receive a verified dose out of province will also now be able to book a single second dose through Halton's booking system once their first dose has been validated and is documented in the provincial system. Given the large volume of submissions in the past week, we are seeking patience from residents, as it will likely take us longer than expected to validate and enter this information. We will prioritize individuals who have received one dose out of province and need to book a second dose in the province in order to ensure they are able to get their second dose as quickly as possible. As we make significant progress in vaccinating our community, we've also expanded eligibility to all individuals who work or go to school in Halton but are not Halton residents. As a reminder, individuals who are part of Essential Workers Group 1, who work in Halton, and youth 12 to 17 who attend school in Halton were already eligible to book an appointment at a Halton clinic. The minimum interval for a second dose remains 8 weeks for those who received AstraZeneca as a first dose and 28 days for those who received an mRNA vaccine as a second dose. Our online booking forms have these minimum intervals built into the system. Next slide, please. To ensure maximum protection against COVID-19 and its variants, residents should get vaccinated with the next available COVID-19 vaccine as soon as possible. Receiving a different vaccine for a second dose is a safe option to gain strong protection from COVID-19. As part of our strategy to get residents fully vaccinated, we have produced videos and fact sheets that explain the interchangeability of COVID-19 vaccines. As of end of day on July the 4th, close to 50,000 Halton residents received a different product for their second dose compared to their first dose. This represents 21% of all Halton residents with 2 doses. Over 25,000 residents who received AstraZeneca for their first dose received an mRNA vaccine for their second dose, and over 24,000 residents switched between Pfizer and Moderna. Over the past month, as a community, we've had to adapt to supply issues, such as receiving more Moderna than expected and less Pfizer than expected. I appreciate the flexibility of residents in this process. Lastly, in follow-up to a question at last month's presentation, other countries around the world have mixed vaccines. For example, Denmark, Finland, France, Germany, Sweden, Norway, and Spain are already offering second doses of mRNA vaccine to people who received the AstraZeneca as their first dose. As the vaccination campaigns unfold in more and more parts of the world, we will continue to see an evolution of strategies and vaccine mixing. Next slide, please. The pace of the vaccine rollout continues to increase. At the end of day on July the 4th, over 600,000 doses of COVID-19 vaccine had been administered in Halton. This is a 67% increase in the past month. We were at about 368,000 doses given on June the 5th. Next slide, please. As of end of day on July the 4th, 79% of the Halton population aged 18 and up has had at least one dose. 44% of the adult population has had 2 doses. Coverage is beginning to even out by age group, but remains highest among the older age groups that were eligible earliest. It is lowest among the population aged 25 to 29, with just 66% with at least one dose. Coverage among youth in Halton compares favorably to other health units in the province, with 75% of our Halton residents aged 12 to 17 having at least one dose. You may have heard that cases of myocarditis and/or pericarditis following immunization with COVID-19 vaccines have been reported in a small number of people in Canada. These reports are very rare, and investigations into the association between myocarditis and pericarditis and the mRNA vaccines continue. The majority of cases have been mild and resolved quickly. As a precaution, the National Advisory Committee on Immunization, NACI, recommends that individuals who experienced myocarditis and/or pericarditis after first dose of mRNA vaccine should wait to get their second dose until more information is available. NACI continues to strongly recommend that a complete series with an mRNA vaccine should be offered to all eligible individuals, including those 12 years of age and older. mRNA COVID-19 vaccines provide very good protection against infection and symptomatic COVID-19 disease, including severe illness, hospitalization, and death. Next slide, please. Following significant work to ramp up at our clinics, our clinic capacity continues to stand at about 8,300 appointments per day. We were administering an average of 6,400 doses per day in the month of June. And so far in the month of July, we're administering an average of over 5,700 doses per day. This does not include vaccines being administered at pharmacies and primary care clinics in Halton. Vaccine supply continues to vary, and we have been adjusting our clinic appointments as required. Next slide, please. Halton has already exceeded all of the vaccination targets for reopening based on the provincial framework. On May the 27th, 60% of Halton residents had at least one dose, which was a key threshold for entering Step 1. On June the 21st, Halton reached the target for Step 2, having vaccinated 70% of adults with one dose and 20% of the adult population being fully vaccinated. Just a few days later, the target for Step 3 was met when 77% of Halton residents were vaccinated with at least one dose and 26% were fully vaccinated. We plan to continue our efforts to provide first and second doses to every eligible Halton resident who wants to be vaccinated throughout the month of July. Based on our current vaccine supply projections and booked appointments, we project that by the end of the month, about 80% of Halton residents aged 12 and over will have had at least one dose, while approximately 60% will be fully vaccinated. Of course, these projections are subject to change dependent on vaccine uptake and supply. Next slide, please. So this alphabetical table shows the percent of residents vaccinated with at least one dose living in each forward sortation area in Halton. As of end of day on July the 4th, it is important to note that vaccine uptake estimates for FSAs should be interpreted with caution as we lack reliable population estimates for areas like L9E and L9T that have grown a lot since the last census. However, the numbers we do have suggest that most FSAs are fairly similar in their uptake. We continue to work to identify areas with lower uptake and target our efforts to increase access and promote vaccination in any areas that appear to have lower uptake. Next slide, please. As you know, our clinics have been running smoothly with many positive comments from the community. The next few slides report findings from our evaluation of our mass immunization clinics. Next slide, please. We have completed 2 surveys of our clinic clients. One was in March and another in May. Surveys were sent to clients who were vaccinated at our community clinics as well as at the Joseph Brant Hospital Clinic. As the quotes on the slide show, clients are very satisfied with their experience at our vaccine clinics. One individual shared, "Everyone I dealt with was professional, cheery, friendly, and compassionate. The system is extremely well organized and well run. I felt very comfortable and well taken care of." Next slide, please. Almost all clients who attended our clinics reported that they had all the information they needed to make a decision about getting the COVID-19 vaccine. They also found it easy to book their appointment and were satisfied with the time of their appointment. This was true for clients who attended clinics in March and in May. Next slide, please. Clients attending our clinics reported high satisfaction with their clinic experience. 99 to 100% of clients were satisfied with their overall experience, the precautions taken to keep them safe, the accessibility of the clinics, their ability to make their way through the clinic, the length of time they had to wait before being vaccinated, and the clinic locations. Next slide, please. Finally, we asked clients why they decided to get vaccinated. The four main reasons provided by clients were: they think it's the right thing to do to control the pandemic, they are concerned for the health of others, they want life to get back to normal, and they are concerned for their own health.